What happens to the mortality? If you see about the mortality, there is not much difference in the rural and urban India. So we saw that the incidence rates were much higher in the urban India, but the mortality rates are not much, there is not much difference. So why is it so? So think of this, that why it is so that the incidence rates are so different, but the mortality rates are not that different. So is it that because of the lack of the treatment facility? Is it because of the lack of the health infrastructure? Or because the patients are coming the late at the time of the presentation so that you can't offer much to them? So is it because of that? So there is a lot of things for the prevention here, because you see that there are the differences in the rates and in the rural and urban in the incidence rates, but the mortality rates are not different. And if you see the sites of the cancers, again, there is a differences. You know, in the some parts of the India, some cancer sites are very common, and in the other parts of the India, some sites are very common. For example, you see in the Mizoram, and even in the Chennai, you will see in the next slide, the stomach cancer is very high. And the stomach cancer doesn't appear in the Ahmedabad, Kolkata, or Dibrugarh, even in the 5 frequent sites. So even within Northeast, between the Dibrugarh and the Mizoram, there is almost 3-fold difference in the stomach cancer rates. And more than 10-fold difference, because the stomach cancer rates are less than 4 here between the Ahmedabad and the Mizoram. So why the stomach cancer rates are higher in the Mizoram, for example, or in Dibrugarh compared to the Ahmedabad, Calcutta, or even in the Mumbai? You know, Mumbai, you don't see the stomach cancer, but you see the stomach cancer there in the northeast in Dibrugarh or in the Chennai. It's again the same metro city, and you have very high rates of the stomach cancer, 11.8, lower than the Mizoram, but still it's very high. So, and then the prostate cancer is very high in some of the cities, like in Delhi, maybe even in the Mumbai, it's the number 3 place. So there is a huge variation even among the cancer types. You know, some cancer sites are very high in some regions of the India. Some cancer sites are not very common in some places. So there is a huge heterogeneity. And this heterogeneity offers you the good opportunity to do a lot of research and to think that why this is happening. And even in the gallbladder cancer, this is again a very interesting cancers which occurs in India. And if you see that compared to the Chennai, the rates are almost 7 times higher in the northeast region. No, 7 times higher rates in the all northeast region. You know, it's a 7, and this is a confidence interval. So these are the point estimates, and these are the confidence intervals. 7 times higher rates there. North India, again, the rates are 7 times in the Delhi. Central India rates are around 6 times higher. But in the western part of the India, the rates are lower compared to Chennai. And then even in the other parts of the South India. So it's again a very interesting geographical differences for the gallbladder cancers. Very highest rates in the northeast, 7 to 8 times, north and the central part of the India, and no gallbladder cancers in the western and the south part of the India. So this gives you a lot of thinking and a lot of clue. Maybe you can think of yourself that what are and then you can discuss this among yourself, that what are the differences in the lifestyle of the region of the south, west, central, and the northeast, which could attribute to the differences in the incidence of the gallbladder cancers. The other thing is, most of the cancers, the good news is most of the cancers are preventable in India. Because if you see any registries, even if you see that most of the cancer sites are different in the different registries, but in most of the registries, almost 40% cancers, if you take the mean of this, it's almost 40%. So the 40% cancers are related to the tobacco. Whether you chew the tobacco or you smoke the tobacco by BD or smoking cigarette, anything. So almost 40% of the cancers are related to the tobacco use. And this is a highly encouraging, because this is a possibility of the prevention there. So if you can run the good campaigning, and if you can convince the people not to chew or smoke the tobacco, then there's a possibility to reduce the cancers by 40%. And the same thing for the female. You see it's not that 40%, but still 15 to 20% of the cancers are related to the tobacco. It's Mizoram and Meghalaya very high tobacco-related cancers, because the female smoking is also quite prevalent in the northeast region of the India. So some parts of the northeast have a very high, even among the female, very high rates of proportion of the tobacco-related cancers, but otherwise, it's almost 20% among the female that you can reduce the cancer by just campaigning about the tobacco and awareness, bringing the awareness. So there is a possibility of the prevention. And among the tobacco-related cancers, if you see, the topmost is the buccal mucosa cancers, because we chew a lot. So there is a lot of, most of the registries have reported that the buccal mucosa cancer is the most common type among the head and neck cancers. And then there is a lung cancer, which is again the tobacco cancers, related cancers. So among tobacco-related cancers, which are most commonly prevalent, they are the esophagus, lung, and the buccal mucosa cancers. They are mostly related. So any questions? Because now we are shifting the gear and we are going towards the trend now. What's happening to trends over the years in India? So the button thing is almost clear for you. So when we think of the trends of the cancer, this is for the male, then you see that incidence rate. So even if the number is increasing in India, so number of cancer cases are increasing because the population is increasing, population is getting more aged, demographical changes are happening, so the number of cancer cases are happening over the years. What we are showing here is the trend. So we are dividing the number with the population, and what we see here is the incidence rate is not changing to that extent. It's almost same, it's just maybe in Delhi it's going up, but otherwise, in most parts of the India, the incidence rates among male is not changing. It's almost constant for last 1 decade. And same thing for the female. It's not, the rates are not changing drastically as the numbers are changing. Numbers are changing drastically, but they are constantly increasing. But the trends of the incidence rates are not increasing. So this has, again, we have to make a distinction. So even if the incidence rates are same, number are increasing, so we still require the infrastructure. So we can't argue that because the incidence rate is not increasing, so we don't require the infrastructure, because after all, you have to treat the cancer patient, you have to treat that number. So that's a major burden for your population. And I think this is for the breast cancer. So overall, the trends are not increasing, but some of the cancers are showing the increasing trend. So like, for example, the breast cancer. So even in the rural India, there is a slight hint that it's now increasing. After 2006, the breast cancer, this is the bar sheet, which is slightly showing the increase now. And most of the registries are showing increase for the breast cancer. And if you see the cervical cancer, it's going down drastically everywhere. So this is, again, the area of the research that the why cervical cancer is going down. We have not done anything like vaccination, we have not done anything like secondary prevention, visual inspection. It's not, no systematic screening program are going on in India. But still there is a changing in the incidence rate. So there must be some changes in the lifestyle or something happening which is causing the cervical cancer down everywhere. Even in the Barshi, it's going down now. So even in the rural, urban India, the cervical cancer is going down without doing anything at the population level. And if you see the breast and cervix cancer, it's very interesting. You see the cervical cancer is going down. So from 30, it's come down to 12. Even from the Chennai 30 to come down to almost 12, 13. Mumbai, it was always less, it's coming down. Delhi, it's coming down. Barshi, it is coming down. Everywhere, it's coming down. And breast cancer is increasing. So breast cancer is constantly increasing across all parts of the India. It's a rural, urban, everywhere it's increasing. So this is a really thinking trend that we have to think hard that why it is increasing and what should be done to prevent or to stop the increase of the breast cancer in India. So I think I should not show this slide. Maybe I can ask you that now I have shown you some data. I have shown you the number. I have shown you how the trends are increasing or decreasing in India. So what do you think? Why these data are so important? Why we are collecting this data? Do you think there is any importance of collecting this data? Can any one of you answer? Then we'll see the answer.
Actually, the importance is that after knowing these data, we can understand the relation between the causative factors, and then we can know better about that, how it is related, and we can control that thing so it can give a better prognostic.
Yeah. So you talk about the causative factor, but we can't determine what is the cause of the cancer.
Yeah,
But we can generate the hypothesis about the causes.
Yeah.
So number one, this data, when you look into the data, it gives you to generate a hypothesis, to put up the question. So that's number one. Anything just number two, and then I will explain all the things in the interest of the time.
So if there is drastic increase in the rate of cancer, then we can start appropriate national programs or state programs to bring it down.
Yes. So the data helps you to guide the national program. I think that's a very important point, that this data are useful to guide your national policies and national programs. So last, maybe I can take from you.
The incidence is higher in that particular part. So in order to streamline the resources for treatment, we can use this data.
Yeah, that's again excellent. That you have to streamline, because you don't have the endless money. You have to prioritize your money, that where you want to put up the money. And then if you know the burden, if you know the number, that this is the area, northeast is the area where the cancer rates are highest, then I'm going to put my whole money for the northeast first state. This is the area where I will put the money to build up the resources. So I think this tells you to building up the resources for the cancer care and for the cancer treatment. This is another important. So this cancer data are telling you about the occurrence of the cancers in the population, which is very helpful to put the resources. Then they study the time trends over the year. This is again very important, that every time you want to see that whether when you put your resources,